Knee replacement is absolutely a wonderful operation. It gives patients a great ability to move again, but it requires full, jumping in with both feet by the patient. They need to want to get better to make it work. But what we do, it's not really a replacement, it's a resurfacing. And so what we do, I have a nice model here. We actually have a joint. We make an incision in the front of the knee. We move the kneecap out of the way. We bend the knee. We take the measurements of your bone during the surgery, and we actually, I'm going to take this little cap off because that's what it is. What we do is we have instruments that allow us to reshape the end of your thigh bone to the inside shape of the implant. So we're not really cutting off a chunk of bone. It's like taking the sole off of a shoe and applying a new sole onto the shoe. And that's the end of the thigh bone that we replace. And we do the same thing for the top of the shin bone. We shave off the top of the shin bone. We know how much bone we take away. We put a piece of metal and a new bearing on the surface, and then we mate the two together, and we have a nice, smooth, realigned knee that we're allowed to have our patient start to walk on. And in most cases, we also resurface the backside of your kneecap with a piece of polyethylene plastic, which is also a new bearing, which allows the kneecap to rub against the new implant here. And a lot of patients will say, gosh, my knee clicks now. But that's what happens when you have a piece of metal clicking on a piece of plastic. And so we like it when that happens because that means the knee is probably on its way to healing.